Hi, this is your week 7 post-op video. So this week we're really going to focus on those vitamins and minerals that are important to have in your diet after surgery. So it's good to remember that these recommendations are based off of what most people that have had bariatric surgery need to maintain their normal levels of these micronutrients. So as you age, depending on what your gender is, your race, your environment, your stress levels, your diet, your activities, how well you sleep, all of these things can impact how you are metabolizing your nutrients and how many micronutrients you really need to do the things that you want to do. And so it's really important to work with your primary care physician to have your labs checked regularly. Ideally you'd want to have them checked once a year. We really recommend at least twice that first year after surgery, and then potentially more frequently depending on if you've ever had any labs with outside of that sort of normal limit. So this is where I really recommend getting a good bariatric specific multivitamin and B complex, and that's because it's really designed for you. If you go to your local pharmacy, a lot of times you end up having to take 3 or 4 tablets to really get that recommended amount of nutrients of each of these specific areas. So what to look for? So first off, you want to have at least 12 milligrams of thiamine, but ideally 50 milligrams, so double check that. 400 to 800 micrograms of folic acid, but if you are a woman of childbearing age, you really want to have about 800 to 1,000 micrograms of folic acid. You also want to look for vitamin A that has 5,000 to 10,000 international units, and making sure that that's a beta-carotene form of the vitamin A. Vitamin K is about 90 to 120 micrograms per day. Vitamin E is 15 milligrams. Zinc for gastric sleeve patients is 8 to 11 milligrams. And for those of you that are gastric bypass patients, you want to have at least 8 and potentially upwards to 22 milligrams. So next is calcium. Now calcium you want to have around 12 to 1,500 milligrams. For men, sometimes you can get away with the 1,200. Females, you want to be closer to that 1,500 milligrams. So I typically recommend getting a calcium citrate version versus a calcium carbonate. And that citrate and carbonate is just the way that the calcium is bound in the supplement. And so citrate tends to be a better quality product because it doesn't need your stomach acid to be absorbed. So frequently, if you have the carbonate, you really need to eat it with a meal. And after surgery, a lot of times you're just not producing as much stomach acid because either a portion of your stomach has been bypassed or has been completely removed. So again, that's where I typically recommend the calcium citrate. So the few things that can kind of be tricky with calcium, one is you really want to avoid taking it with any iron containing vitamins. So frequently your multivitamin will have some iron in it, or any additional iron that you are taking. You also want to try to take the calcium in divided doses. So even though your recommendation may be 1,500 milligrams total, you want to try to take it in doses of kind of 300 to 500 milligrams at a time. So frequently I'll have people take it first thing in the morning when they wake up, put it by your bed with some water, and then take it 3 hours later mid-morning, maybe again an hour or so after lunch, and then if you have any remaining sort of around dinner time or before dinner. It really kind of depends on what you like, but that's just sort of one recommendation that I give. Vitamin D is a supplement that frequently goes along with calcium. Vitamin D requirements are around 3,000 international units per day total. So frequently the vitamin D can be in calcium supplements, and sometimes it's even included in your multivitamins. So you just want to look, just kind of scan that ingredient list and see if vitamin D is added to either of those supplements that you're taking, and then you'll want to get a supplement to kind of support that other 1,000 or 2,000 international units, whatever it may be. So with vitamin D, there are two main sources. There's vitamin D2, which is called ergocalciferol, and vitamin D3, which is called cholecalciferol. Now, you don't have to remember those really long words, but what I would remember is that the D3 is really the better version to take. It's a little bit more available to your body. So looking for that when you go out to purchase your vitamin D supplement. Next is vitamin B12. This is really important. It's a lot of times found in sort of meat or animal products, but because again, you're not producing as much acid after surgery, it doesn't get absorbed as well. And so that's why you need an additional supplement. Typically, we recommend 300 to 500 micrograms per day. The most common way people take that is sublingual, which means it just sits under your tongue. So literally under lingual your tongue, and it dissolves. So this one's nice because it's not something you have to sort of swallow in addition, and it's usually a very small vitamin. Some people will take this in a liquid form. Some people will take it in the nasal sprays. To be honest, I haven't had a lot of patients do the nasal sprays, so I'm just more comfortable with the under your tongue, the sublingual version. You can also do an injection of this, and so you can go to your physician once a month and get 1,000 microgram injection just sort of into your arm. So if you're sick of the vitamins, the minerals, having to swallow them, chew them, whatever it is, having that injection might be one way to just kind of scratch one thing off your to-do list. Finally is iron. Now, for those of you that are low risk of iron deficiency, so you've either never had anemia or a lot of times my males don't have as much of a risk, your needs are probably around 18 milligrams, excuse me. For menstruating females or those of you that have had maybe a significant history of anemia, your needs are going to be 45 to 60 milligrams of elemental iron per day. Again, you want to make sure you're separating your iron-containing vitamins from any calcium supplements by at least 3 hours. So again, as you go through life, your needs will change. At certain points, you might need more of a vitamin or mineral. At certain times, you may need less. And again, that's why it's really important to make sure that you're working with your primary care physician and getting those labs checked regularly. Just because they've been within the normal limits for the last 5 to 10 years doesn't mean that 1 year they won't be off. So that's very, very important. I can't really state that enough. So there you have it, week 7, some vitamin mineral recommendations. Thanks. So the world of vitamins and minerals can always get a little confusing. Please share any questions or comments that you have about vitamins and minerals in your sort of supplement regimen in the comment section below. And as always, please remember to share and like this video. Thanks.